Somewhere in America, in 1956, a man lit his first cigarette. He was 23 years old. He had just come back from Korea. He bought the pack from a machine in the lobby of the hospital, where his brother was being treated. One of those gleaming chrome dispensers that stood in hospital corridors across the country, stocked and serviced by the tobacco companies themselves. Positioned there with the deliberate logic of an industry that understood, with great precision, where frightened people congregated and what frightened people reached for. The pack said nothing about cancer. The machine said nothing about cancer. The doctor who passed him in the corridor, who nodded at the cigarette with the comfortable familiarity of a man who smoked the same brand himself, said nothing about cancer. Nobody said anything about cancer. Not because the science did not exist, not because the question had not been asked, not because the research had not been conducted, the data compiled, the conclusions reached and committed to paper in the carefully calibrated language of men, who had spent their careers learning how to say what they meant without saying it where anyone else could read it. The science existed. The conclusions existed. The internal memoranda shrouded in attorney-client privilege and locked in filing cabinets in Louisville and New York and Richmond existed. The man with the cigarette just did not have clearance to read them. His name was Raymond. He smoked for 31 years. He died of lung cancer in 1987. He was 54 years old. His medical file, in the column where the cause is recorded, carries one word: cigarettes. The filing cabinets that could have warned him were still locked. By 1950, the science was already accumulating. Ernst Winder and Evetts Graham had published their landmark study in the Journal of the American Medical Association, the first large-scale statistical analysis, demonstrating a clear and significant correlation between cigarette smoking and lung cancer. It was followed, that same year, by Richard Doll and Austin Bradford Hill's study in the British Medical Journal, which reached identical conclusions through independent methodology. The data, from two continents, was pointing in one direction, with a consistency that, in any other field of medicine, would have triggered immediate and urgent public health action. The tobacco industry did not ignore this research. That is the critical point that is most frequently misunderstood. Did not bury their heads. They read every paper. They commissioned their own studies. They hired their own scientists. And in 1953, when their own researchers, working with data from the Sloan Kettering Institute, confirmed the cancer link internally, the industry did something that required considerable intelligence and considerable absence of conscience. Simultaneously, they decided that the most profitable response to the truth was not denial. It was the manufacturing of uncertainty. In December 1953, the chief executives of the major American tobacco companies met at the Plaza Hotel in New York City. The meeting was facilitated by John Hill, founder of the public relations firm Hill & Knowlton. What was decided in that room, over the course of a single afternoon, became the template for corporate scientific fraud that would be replicated by the asbestos industry, the leaded petrol industry, the sugar industry, and the fossil fuel industry for the next 70 years. The strategy was this: you do not deny the science outright. Denial is easily disproven, and draws attention to the very finding you wish to suppress. Instead, you fund alternative research, not to find a different answer, but to produce the appearance of scientific controversy where none exists. You create institutions with credible-sounding names. You cultivate scientists willing to testify that the evidence is inconclusive. You repeat, in every public forum available, that more research is needed, that the question remains open, that it would be irresponsible to alarm the public on the basis of preliminary findings. And you make absolutely certain that your own internal research, the research conducted by your own scientists, which confirms what the independent researchers have been saying, never leaves. The Building.1 executive wrote it plainly in a 1969 internal memorandum. The sentence, when it eventually became public, became perhaps the most honest thing the tobacco industry ever committed to paper. He wrote, "Doubt is our product." His name was Dr. Jeffrey Wigand, but he came later. Before Wigand, there were others, researchers inside the industry's own laboratories, whose names we know from the documents they produced and the careers that were quietly ended when those documents became inconvenient. The internal research culture of the major tobacco companies in the 1950s and 1960s was, by the accounts that have since emerged, genuinely scientific. The researchers were not frauds. They were trained biochemists, oncologists, physiologists, people who had entered the field with the genuine intention of understanding how their product interacted with the human body. Some of them believed, when they were hired, that the cancer link would prove to be overstated. The data changed their minds. Their employers did not change their contracts. What happened to a scientist inside the tobacco industry who reached the wrong conclusion? The conclusion that the product caused cancer was not dramatic. There was no confrontation, no raised voices, no locked room. There was a meeting, a conversation about research direction, a quiet suggestion that certain lines of inquiry were not currently a priority, a reassignment, a performance review that had not previously been a concern. And eventually, one way or another, the departure of someone whose data had become a liability and whose silence could not be guaranteed so long as they remained on the payroll. The lawyers understood this system better than anyone, because it was the lawyers who had designed it. Beginning in the early 1950s, the tobacco industry's legal teams developed a doctrine, applied with remarkable consistency, across all the major companies that placed all internal scientific research under attorney-client privilege. This meant that any research conducted at the instruction of, or in consultation with a company lawyer, was legally protected from disclosure in civil litigation. It was a masterpiece of structural thinking, by rooting their own scientific inquiry. Through their legal departments, the tobacco companies created a system in which the most damaging evidence they possessed was simultaneously the most legally protected. Their scientists could continue their research, could even, in some documented cases, reach accurate and damning conclusions, as long as those conclusions were addressed to a lawyer rather than published in a journal. The truth could exist. It simply could not leave the building. Jeffrey Wigand walked into this system in 1988 as Vice President of Research at Brown and Williamson. He was a biochemist. He was thorough. He was, by his own account, genuinely surprised by the depth of what he found. He had not expected to discover that his employer had suppressed research into a safer cigarette specifically because a safer cigarette implied, legally and commercially, that the current cigarette was unsafe. He had not expected to find documents demonstrating that the company had deliberately manipulated nicotine levels to sustain addiction. He had not expected, when he raised these findings internally, to be told in terms that left no room for misinterpretation that his job was to produce research that supported the company's legal position, not research that undermined it. He was fired in 1993. He signed a confidentiality agreement in exchange for his severance package and his health insurance. The ink was barely dry on the non-disclosure form before the company's lawyers began preparing for the possibility that he might talk anyway. He talked anyway. On the 14th of April, 1994, 7 men sat before the United States Congress. They were the chief executives of the 7 largest American tobacco companies. They had been subpoenaed by the House Energy and Commerce Subcommittee on Health and the Environment, chaired by Congressman Henry Waxman. The hearing room was filled with cameras. The occasion had the quality of a historical event, which in retrospect it was, though not in the way the committee had perhaps intended. Waxman asked each man a single question. Do you believe nicotine is addictive? Each man answered under oath. Each man said no. 7 chief executives. 7 sworn statements before the United States Congress. 7 denials of a fact that their own internal research had confirmed in writing, in detail, with full scientific methodology, for decades. Documents that existed in the filing cabinets of their own legal departments described nicotine manipulation in the precise clinical language of addiction science. Research commissioned by their own companies had characterized the cigarette, in one internal memo, as a nicotine delivery device. Their scientists had been studying addiction mechanisms since the 1960s, studying them carefully, studying them thoroughly, studying them in full knowledge that the findings could never be published. And 7 men sat before Congress and said, no charges of perjury were ever brought. The same year, -1994, a paralegal named Merrill Williams, who had been hired to organize documents for the law firm representing Brown and Williamson, smuggled thousands of pages of internal research out of the firm's offices. He had been copying documents for 4 years. He had read what he was copying, and he had decided, at considerable personal legal risk, Brown and Williamson sued him immediately, obtained a restraining order, and attempted to reclaim the documents through every legal mechanism available, that the public had a right to know what those filing cabinets contained. The documents reached Jeffrey Wick. They reached journalists. They reached state attorneys general who were preparing the litigation that would eventually become the Master Settlement Agreement. The filing cabinets had finally been opened. It had taken 41 years. Let us be precise about what the tobacco industry purchased between 1954 and 1994. They purchased 40 years. 40 years during which the public health response to a known and documented lethal product was delayed, diluted, and obstructed through the systematic manufacture of scientific uncertainty. During those 40 years, the industry funded over 50 research organizations designed to produce the appearance of legitimate scientific debate. They placed scientists on retainer, not to conduct research, but to testify. They placed advertising in medical journals. They placed cigarette vending machines in hospitals. They sponsored sporting events and funded politicians and cultivated relationships with regulatory officials whose job was to protect the public from exactly what the industry was selling them. They bought doubt in a democracy that requires scientific consensus before legislative action, is the most valuable commodity available for purchase. The law, in this period, was not a shield for the smoker. It was a wall behind which the industry operated. Attorney-client privilege sealed the research. Confidentiality agreements silenced the scientists. Civil litigation was fought with resources so vastly superior to any individual plaintiffs that most cases were settled or abandoned before discovery could expose the internal documents. The regulatory agencies, the FDA, the FTC, operated under statutory frameworks that the industry had actively lobbied to keep weak, narrow, and unenforceable against the specific practices they were engaged in, and the consumer Raymond, and the hundreds of millions of people like him, had no access to any of this. He had the advertising. He had the doctors in the magazine spreads. He had the frank statement of 1954, the full-page newspaper advertisement, in which the industry promised to put the health of its customers above all other considerations, pledged to support independent research, and expressed its commitment to public transparency. He had the promise. He did not have the filing cabinets. In November 1998, the attorneys general of 46 American states reached an agreement with the 4 largest tobacco companies. The Master Settlement Agreement, $206 billion, to be paid over 25 years. The largest civil settlement in American legal history at the time. The agreement required the companies to fund anti-smoking campaigns, to dissolve the Tobacco Institute, to release their internal documents, the same documents that had been sealed for 40 years, to a public archive. To accept certain marketing restrictions, it did not require any executive to serve a single day in prison. The 7 men who had raised their right hands before Congress in 1994 and stated, under oath, that nicotine was not addictive, not one of them was prosecuted for perjury. The lawyers who had designed the atonically and privileged structure that sealed the research for 4 decades faced no professional sanctions. The scientists who had testified before regulatory bodies about the uncertainty of the cancer link, while their employers possessed internal documentation confirming it, no charges were ever brought. $206 billion is a number that sounds like accountability. It was, in practice, the cost of continuing to operate. The tobacco industry paid the settlement. passed the cost on to consumers through price increases, and continued selling cigarettes. The settlement contained no admission of wrongdoing. It was not a confession. It was a transaction. Raymond. The man from the hospital corridor. The man who lit his first cigarette beside his brother's room and smoked for 31 years, was already 7 years in the ground by the time the settlement was signed. His family received nothing. His name appears in no legal document connected to the case. He was not a plaintiff. He was not a witness. He was not a data point in the settlement negotiations. He was simply one of the people the filing cabinets had been sealed to protect the industry from, and the sealing had worked. For him, completely. The Tobacco Master settlement documents are publicly available today. You can read the internal memos. You can read the research reports. You can read the strategic planning documents in which men in conference rooms decided, with the calm deliberateness of people who believed they would never be held to account, that the most profitable response to the truth was to ensure that as few people as possible ever had access to it. The documents are all there, 41 years of them. The science that was buried, the research that was classified, the memos that mapped, in real time, the architecture of one of the largest and most consequential acts of public deception in modern history. You can read every word. Raymond cannot, and that, in the end, is what the filing cabinets were always for.